My name is Sicco Bus. I'm a professor of clinical biomechanics working at the Amsterdam University Medical Center in Amsterdam, Netherlands, within the rehabilitation medicine department, and the academic hospital is connected to the University of Amsterdam. So DIALECT is the diabetes lower extremity training and research network, which is a European project funded by the European Committee, and it focuses on ulcer prevention and amputation prevention through 11 PhD projects throughout different host institutes in Europe, where we really want to go beyond state of the art in our knowledge on what causes foot ulcers to develop in people with diabetes. So that's better knowledge on the biomechanics, and the profiles and the behavior of the patient that may cause foot ulcers to develop. Also the footwear that we can develop that helps prevent these foot ulcers, because with preventing foot ulcers we can prevent amputation. And amputation is a very devastating outcome of diabetes, and that has a lot of effects on quality of life, on mortality, and many patients are affected within Europe by amputation. So we really want to use DIALECT to further develop our knowledge with which we can help prevent these amputations from occurring. One important aspect about the DIALECT project that we want to stress and we want to focus on is further developing the footwear for patients at different risk levels, so either being at a moderate level or at a high risk level requiring special footwear. And that's what we have 4 projects on within DIALECT, 2 in Italy, 1 in Amsterdam, and also 1 in Glasgow, that really sort of ties together the next generation of footwear for these different risk categories, either from a shoe perspective or from an insole perspective, that will hopefully help us to further increase the knowledge to create even better footwear for these patients. The use of data is becoming more and more important in our research on diabetic foot disease, but also within the DIALECT project, where we aim to assess foot pressures, not only for research but also in the patient care. We assess them for their physical activity, so how active are they during the day in all kinds of aspects of walking, sitting, standing. And we also want to know and measure how well they use their prescribed footwear to better understand how those aspects relate to the development of the clinical problems that they get, such as a foot ulcer, but also use it in the design specifically for footwear, for example, where we use pressure analysis to evaluate how well the footwear offloads the foot, but then also use that to further improve the footwear to create the best kind of solution for a given patient. We really want to take the approach of going from, let's say, stratified healthcare towards personalized medicine. So the more data we can collect and sort of integrate that from the activity of the patient, so not only what we measure in the lab, but also what we measure outside of the lab, more importantly, is to combine that. We assess the data objectively, so we don't use questionnaires, but we measure the pressure with platforms and with in-shoe pressure measurement systems. We measure the activity by wearing activity monitors on the body that have been validated and are reliable, and also by inserting sensors inside the shoe, so we can actually measure when during the day and how much the shoes are used. Because we can only rely on this kind of data and use it for the purposes that I just explained in trying to improve the treatment of these patients and better understanding why they develop clinical problems or not, if we can rely sufficiently of course, on having proper, accurate and reliable data. And so the nice thing about DIALECT is that it's really a unique project, not only from the fact that it's a European consortium where many different partners work together, but it's also the largest project on foot ulcer and amputation prevention in diabetes within Europe at this moment. So we really want to take the different partners on from university hospitals, from industry, from implementation, from universities all together, so that with the consortium that we have, provide a very nice research environment and also a training environment for the next generation of scientists